I've been experiencing some dizziness.
Dizziness,
as well as some headaches.
Okay. And I see that I have your medical chart from your previous doctor. May I please have your first name and date of birth?
My name is Amber, and my date of birth is May 4th, 2003.
Okay. And when is the last time that you had a head-to-toe medical assessment done?
Maybe like 6 months ago.
Any abnormal findings, anything that your previous doctor was concerned about?
No.
All right. Do you have any known allergies?
I'm allergic to shellfish.
Shellfish. Okay. Any medications that you may be taking on a regular basis?
Sometimes I take ibuprofen.
Ibuprofen, okay. Is that for the headache?
Yes.
And how often does the headache happen?
Once every 2 to 3 days.
Okay. Do you follow a certain diet?
I try to eat healthy, but not particularly. I'm not a vegetarian.
Okay. And tell me a little bit about the headache. On a scale of 1 to 10, how intense is it?
I'd say about, maybe a 7.
A 7.
But sometimes it's a 5.
And does the dizziness come with the headache, or do they happen at different times of the day?
Sometimes.
Okay, so they may be correlated. And do you know if you're doing something in particular while the headache arises? Are you sleeping?
It happens a lot more when I go to the beach.
When you go to the beach, okay. Okay. Any problems with your vision? Blurred vision?
Sometimes a little bit when the dizziness happens.
Okay. Blurred or double? Blurred vision or double vision?
More blurred.
More blurred, okay. And for how long does it last?
A couple of minutes.
A couple of minutes, okay. Any issues with your hearing?
No.
Okay. Any recent ear infections?
I got swimmer's ear when I was at the beach.
Okay. Swimmer's ear. Were you on any antibiotics for that?
No.
Okay. Any back problems? Any joint pains? Anything? No.
Sometimes in my shoulders, but not much else.
Okay, shoulder pain. Okay, so let's go ahead and give you a full body medical examination today and see if we can get to the bottom of what's giving you the headache. Do you have any history in your family of migraines?
I think I have an aunt who gets migraines, but she's my uncle's wife.
Okay. All right, I'm gonna go ahead and set this aside, and I'll start by putting on my gloves. And I will take your vital signs and start by examining your head, your ears, your eyes, and see if there's anything neurological that may be contributing to these headaches. Then I'll work my way down and check your back, your abdomen, your legs, and your feet. And are you experiencing any pain right now?
Not really, but a little bit this morning.
Okay. On a scale of 1 to 10, how intense was the pain this morning?
About a 4 or 5. Not terrible.
Did you take any ibuprofen today?
Yes, I took one.
Okay. I'm gonna go ahead and make a note of that. So morning pain. And you just took an over-the-counter pill.
Mm-hmm.
So that was probably at most 200 milligrams
Yes.
ibuprofen. Okay. All right. So let's go ahead and check your levels of oxygenation. So I'm going to go ahead and place this on your index finger. Right there. You can just set it aside. We'll leave it there for a second. I'm going to go ahead and take your temperature. This is going to go over your forehead, behind the ear. 98.7. So that's a very good temperature. Have you had any flu-like symptoms in the last 2 weeks? Any
No.
runny nose, sneezing? No. Okay. All right, so 99% oxygenation and about 85 beats per minute, so good pulse and good levels of oxygenation. I'm gonna write this down. 99% oxygenation, 80 beats per minute, normal temperature. Okay, very good. All right, I'm gonna go ahead and listen to your heart and your lungs. This is just alcohol pad to just sanitize the stethoscope. Have you had any heart palpitations, anything concerning with your heart?
I don't think so.
Okay. Any lungs issues?
No. Sometimes when I run, it hurts, but I'm also bad at running.
Okay. How long do you run for?
10 to 15 minutes.
Oh, okay. That's pretty good. And is the pain intense?
No, it's just in my ribs.
Oh, in your
Just
rib.
a little bit.
Okay, right here, so not in your heart.
Mm-hmm.
Okay, that could happen while you're running. So let me go ahead and listen to your heart. Go ahead and just breathe normally. I'm looking for any murmurs, any abnormal sound. I'm able to hear S1 and S2, not hearing S3 and S4. I'm going to switch to the bell side as well. Good. So heart sounds normal. I'm gonna go ahead and check your lungs. So go ahead and take a deep breath in and out. Deep breath in and out. Okay, you can just breathe normally now. Looking for any crackling, hissing sounds. Go ahead and cough slightly. Okay. Okay, good. All right, I'm not able to hear any adventitious sounds, so your lungs sound perfectly healthy. Okay. Let's go ahead and check your blood pressure. Have you had this done before?
Yes.
Good. So you know what to expect. Okay, go ahead and hold this one for me. Good. And let's slide your arm. There. Put your arm right there. Okay, let's turn this on like this so I can see it. Okay. Okay. So your blood pressure is a little bit on the low side, 100/60. How much water do you usually drink?
About 5 or 6 cups a day.
Okay, 100, 5 or 6 small cups or big cups?
About this big.
Okay, so that should be a good amount. Do you use any alcohol or tobacco on a regular basis? No.
Sometimes instead of water, I drink juice though.
Okay, you drink juice instead of water. Okay. Any difficulty breathing ever?
No.
No. Okay. Okay, so the lower blood pressure may make me think a little about dehydration, but you mentioned how much water you're drinking, and that should be sufficient. Do you ever get any cracked lips or any dryness in the mouth?
Sometimes.
Sometimes, okay. All right. So I'm gonna set this aside, and I'm gonna go ahead and start by examining your scalp and your head. And I'm going to be palpating and touching you to feel for any lumps, any bumps, any tenderness. Let me know if you feel anything abnormal. All right. So let's go ahead and just feel your head. Applying slight pressure. Any pain here? Any pain here?
No.
Okay. Not able to feel any lumps or bumps in the back of the head. Head is symmetric, no deviations, no indentations. I'm going to press down lightly on your mastoid bone process behind the ear. Any pain here?
No.
Okay, good. All right, I'm going to palpate your neck. And feel your lymph nodes. to begin by assessing your preauricular lymph node in the front. And posterior auricular in the back, occipital towards the back of your head, tonsillar, moving underneath the jawline, submental lymph nodes, and mandibular. They're all mobile, not enlarged. I'm going to check your cervical lymph nodes as well, on your neck area. Not enlarged. I'm going to feel your supraclavicular lymph node above the clavicles. Good. And your axillary lymph node. Okay. And pectoral. Good, not enlarged. Okay. Good, and pectoral. Not enlarged, very good. Okay, I'm going to do just a quick skin inspection. Have you noticed any rashes, any itchiness or dryness?
No.
Okay, so nothing bothering you with the skin. I'm going to inspect your face as well. Look for any micro lesions, any psoriasis signs, any colors that may not be what we would expect. Okay. I'm going to check your hairline as well. If you can tilt your head over to your left. Like that, yes. Okay. And over to your right. I'm looking for any skin abnormalities. Okay, nails do not appear to be clubbing or pitting. Going to inspect the palmar region of your hand. No signs of any palmar erythema. Capillary refills within 2 seconds. Okay. No signs of any skin abnormalities. Okay. I'm going to go ahead and do a quick scalp inspection and check the hair as well as the hair on your face, your eyebrows, your eyelashes. Exploring your hairline. You can move your head towards your left. Normal hair distribution. The color on your scalp blends well with the color on your face. No signs of any alopecia, no hair loss, no dandruff either. That's good. I'll go ahead and inspect your scalp and your hair for any potential infestation. So if you can move your head towards your left and just hold it like that. Just going to brush through your hair. I'm not seeing any signs of infestation, no hair loss, no breakages. Let me take a look over on the other side as well. Okay. Going to go ahead and inspect your eyebrows and check the hair distribution. They are symmetric. distribution. Okay, your eyebrows, your eyelashes are also symmetric. Your face overall is symmetric. And I'm not seeing any redness, no swelling. Okay, can look this way. Just going to see how your skin reacts when being pressed slightly. Okay, good. Normal skin elasticity. Good blood flow. Okay. Do you feel this equally on both sides of your forehead? Good. Yes. V1 is clear. Do you feel this equally on both sides of your cheeks?
Yes.
Good. V2 is clear. Equally on both sides of your jawline?
Yes.
Okay. V3 is clear. Next up, we're going to do a test that's called sharp or dull. May I have your palm, please? Okay, this is dull, and this is sharp.
Okay.
So keep your eyes closed and tell me if you feel sharp or dull.
Dull.
Good.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Dull.
And do you feel this continuous all throughout your arm?
Yes.
Any loss of sensation?
No.
Okay, good. How about over on this side? Continuous all throughout?
Yes.
Same intensity? Good. And do you feel this?
Yes.
Okay, and this?
Yes.
Good. Alright. I'm going to touch you with slightly sharper tool. Go ahead and keep your eyes closed. And just say yes when you feel it.
Yes.
Okay.
Yes. Yes.
Okay.
Yes. Yes.
Okay.
Yes. Yes. Yes.
Okay. I have here a slightly cold and slightly warm object. Keep your eyes closed and tell me if you feel warm or cold.
Cold. Warm.
Good.
Cold. Cold.
Good.
Warm.
Good.
Cold. Cold.
Good.
Warm.
Good.
Cold. Warm.
Good.
Warm. Warm. Cold. Cold.
Good. Okay. Next up, I'm going to touch you with slightly sharper tool. And I want you to tell me if you feel me touching you on your left side or on your right side.
Right. Left.
Okay, good.
Left. Right. Left. Right.
Good.
Left. Right.
Good.
Right. Left.
Good. Okay. I'm going to check your sensations to vibrations. Keep your eyes closed and tell me if you feel this.
Yes.
Good. And now I want you to tell me when the vibration stops.
Stop. Or no. Stop.
Good. Okay, let's try that one more time. So do you feel the vibration?
Yes.
Okay.
Stop.
Good.
Stop.
Good. And is this louder or this? 1 or 2?
1.
Good. Is this louder? 1 or 2?
1.
Good. Okay. I'm gonna go ahead and check your eyes. You can open your eyes now. And just look into the distance. Just going to check how your pupils respond to light. Okay, good. 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 And now look at me. At the tip of my nose. Good. Good. Pupils dilate and contract in the normal amount and at the normal rate. And they are about less than 3 millimeters. That's good. Okay. Now I want you to look right here and try to keep your head steady. Just follow the light. I'm checking for your eye mobility at the periphery. Any double vision right here?
No.
Okay, any pain as you're stretching the eye muscles?
No.
Okay, good. Eyes are moving together, synchronized movements. Good, perfect. And now look at my fingers right here. And at the light, try not to move your head. My fingers, the light, fingers, light, fingers. Perfect, good. So eyes are moving together, synchronized, no skipping or lagging. No problems with the binocular vision and the periphery. Very good. I'm going to go ahead and inspect the back of the eye. And I'm going to use an ophthalmoscope for that. And I'm going to check your sclera and your macula and take a look at the optic disc. Okay, you can just look into the distance for me. And I'm just going to get a good perfect, good clear vision into your eye. I'm gonna try to pull up slightly on your eye. So go ahead and continue looking in the distance. Okay, look up, look down, left and right. And now look right into my stethoscope. Perfect. Good. So optic disc is intact. I'm not seeing any scratches, no tears, no obvious abnormalities. Your sclera is white. Can you look up for me? Going to look at the conjunctiva, which is pink and moist. Very good. All right, I'm going to do the same over on the other eye. So continue looking in the distance. Okay, I'm going to try to get a clear view. Perfect. Okay, I'm going to pull slightly up on your eyelid. And just take a look inside. No blood vessels. Optic disc is round and intact. Well-defined margins. Look up for me. Down. Left and right. Perfect. Good. Alright, I'm going to go ahead and do some light tapping on your head, your face, and your bony prominences. And I'm checking for any pain, any sharp shooting triggers. So let me know if you feel any of that. Okay. Any zapping. Can keep your eyes closed. I'm going to start with the top of your head. Any pain here in the shoulders?
No.
Okay, that's good. Alright, very good. Okay, I'm going to focus on your ears next. So you mentioned you've had swimmer's ear.
Yes.
Okay. I'm just going to palpate the ears. Just pull slightly out, down on the ear auricle and up. Any pain when I do this?
No.
Okay, good. Okay. Can move your head over towards your left. Just inspecting the outside of the ear. The ear auricle is pink, no discharge, no inflammation. No moles. Okay. I'm going to go ahead and use my otoscope to take a look inside your ear canal and see if there are any signs of infection. Okay. Okay, I can see your tympanic membrane. Well-defined margins, pearly gray color. No signs of any infection or inflammation. And I can see all the bony landmarks. Okay. Let's take a look over on this ear. You can move your head towards your right. Okay, oracle of the year is pink, no discharge, no inflammation. I'm gonna take a look inside. Good, normal. No signs of any infection, no inflammation. Tympanic membrane is normal. Okay, how about your nose? Have you ever experienced anything abnormal, any weird smells, anything?
No, I did have a sinus infection when I was little.
Sinus infection, okay. Any infections in the last 6 months?
No.
Okay. So I'm gonna go ahead and just palpate your sinuses and your nose, pressing down on your maxillary sinus. Okay. And your frontal sinus. Good. Okay, no infection, no inflammation of the nose, the bridge of the nose is straight. Any pain when I do this?
No.
Any pain when I do this? Good. Okay. Let's take a look inside your mouth. And I'm checking for any infections, anything in the back of your throat that may be abnormal. If you can open your mouth wide for me and say, okay. Uvula is present, no infection. Good, very good. All right, Amber, go ahead and lay down and I'm going to take a look at your tummy and your back.
Okay.
Okay, Amber, are you nice and comfy? Okay, I'm going to go ahead and uncover your abdomen if that's okay with you.
Yeah.
Okay. I'm just going to do just a visual inspection of your tummy. I'm checking for any indentations, any swelling. Skin appears normal, no swelling, no redness. Going to check the elasticity of your abdominal area. Okay, I'm able to grab a similar amount of skin from both sides of your abdomen. And the skin is as elastic as I would expect it. I'm going to go ahead and check sensations of your abdomen. And do you feel this?
Yes.
Is this sharp or dull?
Dull.
Good. And do you feel this? Sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp.
Okay, good. So skin sensations are normal, symmetric. And you can feel sensations in all 4 quadrants of the abdominal area. I'm going to go ahead and palpate your tummy and feel for any lumps or bumps, any potential masses. I'm going to start off with the light superficial palpation. Okay, I'm going to assess the size of your liver. Go ahead and lift up your legs a little bit. And the other one too, yeah. So that the abdominal muscles are not tight. Okay. So take a deep breath in for me. Good. Liver is normal. Going to assess the size of your spleen. Okay, that's normal too. Stomach is normal. Okay. Going to go ahead and listen to your tummy. I'm able to hear normal abdominal activity, which can be heard in all 4 quadrants. No swooshing sounds, just a little bit of gurgling, but that's expected. Okay. Alright, go ahead and flip on the other side so I can take a look at your back. Alright, I'm going to go ahead and just inspect your back. Just check the skin on your back first. Okay. I'm looking for any abnormalities, any signs of psoriasis, skin infection, dermatitis. Okay. The spine visually appears to be straight. I'm going to go ahead and palpate. Checking for any deviation of the spinal bones. No lumps are felt and the spine is straight. Okay, I'm going to go ahead and listen to your lungs. Lungs are clear in the back as well. The base of the lung sounds good. No abnormal sounds. Okay. I'm gonna go ahead and tap on your back. And let me know if you feel any sharp shooting pain, any zapping. Okay. Checking your scapula. And looking for the resonance. Good. Okay, I'm going to slide a slightly cold object down your spine, and I want you to note if the sensation is continuous. Okay, any loss of sensation there? No. Okay, good. Any loss of sensation? No. Okay. How about that? And this. No. No. Okay, how about that? No. Good. Any loss of sensation? No. Good. Okay, Is this sharp or dull?
Dull. Sharp. Dull. Sharp.
Good. Okay, I'm going to do slightly deeper palpation and check for any lumps or any bumps underneath the large superficial muscles of the back. Not feeling any deformities, no lumps or bumps, no inflammation of the muscles. The spine is straight. Alright, I'm going to go ahead and take a look at your legs and feet. Okay, is it okay if I remove your socks?
Yes.
That's one. The other one. Okay. So I'm going to go ahead and do just a visual inspection of your calf muscles and the plantar region of your feet. I'm going to go ahead and palpate. Check for any signs of edema. Okay, let's see the response. Good. And then, good, perfect. All right. Not noting any inflammation of the calf muscles or external signs of edema. I'm going to palpate the calcaneus region of your feet. Any pain there?
No.
Any pain there?
No.
Okay, good. I'm going to do the Babinski test. Perfect. And over on your right foot. Good. Excellent. Okay, can you wiggle your toes for me? Good. I'm going to palpate the plantar region. Okay. I'm going to place my finger underneath your toes. Can you curl them up for me? Perfect. Okay. Any pain here?
No.
Any pain here?
No.
Here? No. Good. Okay, I'm going to inspect your toenails. Good, no signs of any nail clumping or pitting. Looking in between your toes for any hidden melanomas or moles. Good. And palpating your right foot in the plantar region. Any pain here?
No.
Any pain when I did this?
No.
How about when I did this?
No.
Good. All right, curl your toes up for me. Perfect. And any pain here?
No.
Okay, how about here?
No.
Good. Okay. Going to go ahead and test the sensations in your feet and your legs. I'm going to spray a little bit of water. Go ahead and tell me if you feel it on your left foot or on your right foot.
Left.
Good.
Right.
Good.
Left. Right. Left. Right. Right. Left.
Good. Okay. Do you feel that?
Yes.
Do you feel this?
Yes.
Is the sensation continuous?
Yes.
And this one?
Yes. 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 Yes.
Okay. Okay, go ahead and try to bring your big toe curly backwards towards your head. Good. And now try to curl your pinky toe towards your head. Perfect. So good mobility. Go ahead and try to bring your toe towards your head. And now your pinky. Perfect. Okay. Do you feel this?
Yes.
And this?
Yes.
Good. And do you feel this?
Yes.
And this?
Yes.
Good. And do you feel this? And this?
Yes.
Good. All right. All right, Amber, so I did a very thorough examination of your whole body. I've not been able to find anything abnormal from a neurological point of view. Everything checks out, so you don't seem to have any systemic issues. But the headache and the dizziness, I want us to monitor that. And I'm going to write a note for a CT scan for you to get your head checked out a little bit more in depth. The low blood pressure makes me think that you may be a little bit dehydrated, though I'm not noticing any external signs of dryness. Your lips, your mouth are not dry. There's no pitosis around the mouth. So it may be a little bit of dehydration. So try to drink a little bit more water. You said you drink up to 6 glasses of water a day. Try to drink anywhere between 6 and 8 if you can.
Okay.
And let's see whether that improves the symptoms in any way. So we'll have you get a CT scan. When was the last time you had your blood tests done?
About 2 years ago.
2 years. Okay, so you're about due for those as well. And we can check your levels of minerals, your liver function, vitamin D, vitamin B. And let's see if we need to make any changes to your nutrition. All right. Other than that, I'd like to see you back in a couple of months and see how the headache progresses.
Okay.
Do you have any questions for me today?
No.